All right, let's pull back the curtain on the healthcare system. I know, it can feel like a total maze, right? But stick with me. And by the end of this, you'll basically have a map to see how all the different pieces connect.
You know when you're in a hospital, you see the doctors and the nurses rushing around, you hear all the beeping machines, but behind all of that, there's this huge, invisible world of information and tech that makes it all tick. So, what is actually going on back there?
And hey, it's no wonder it feels so confusing. See, a lot of countries have, one single system. The US, it's more of a hodgepodge, a mix of public and private models all jumbled together. So let's try to unpack how that hodgepodge actually works.
Okay, to really get a handle on this, we need to shift our thinking. Let's stop picturing healthcare as just one building, like a hospital, and start seeing it as a whole ecosystem.
So the key thing to remember is that a hospital isn't an island. It's just one part of this huge interconnected web. Think about it. Your local clinic, your insurance company, the lab that runs your tests, they all have to rely on the exact same accurate info to take care of you properly.
Whoa. Okay, so this chart, it really lays out just how complex this is. If you follow the lines, you could see how information zips from the clinical side, your doctors and nurses, all the way over to the admin and finance folks. And holding it all together, this massive IT infrastructure. It's like the digital nervous system of the whole operation. Every single piece has to be in perfect sync or things start to fall apart.
The best way to see this whole ecosystem in action is to actually follow a patient's journey. So let's meet Alex.
So Alex is having a really scary day. They show up at the emergency department with chest pain. And right from the moment they walk in, that whole ecosystem we've been talking about just kicks into overdrive to figure out what's going on and how to help.
Instantly, the team starts generating a ton of data. They're taking vital signs, ordering lab tests, requesting scans, and every single one of those actions creates a new, critical piece of information. All of this new data has to go somewhere. It needs to be captured, organized, and shared, like right now.
And this is where information technology becomes the absolute lifeblood of the hospital. All that data, it needs a safe, efficient place to live and a way to move around.
Okay, so the main hub for all this information is something called the Electronic Health Record, or EHR for short. The best way to think of it is like the digital brain for patient care. It holds everything about Alex's medical history in one spot. That means every single person on the care team, doctors, nurses, specialists, they're all looking at the exact same up-to-the-minute record.
So the EHR has three really important jobs. First, it has to store all that data safely so nothing gets lost. Second, it's got to share it, so the lab team and the doctor are seeing the same thing at the same time. And third, it has to protect patient privacy. This is a huge deal, and it's all part of HIPAA. That's the federal law that's super strict about who can see your health info.
Let's walk through an example to see how cool this is. The doctor orders a blood test for Alex, right there in the EHR. Boom! The lab gets that order instantly. Then, Alex's sample gets a unique barcode, so there's no way it can get mixed up. A machine runs the test, and then, here's the magic part. The results are automatically sent right back into Alex's EHR for the doctor to see. It's this perfect, seamless loop of information.
But amazing medical care is only half the story. While all of this is going on, there's a whole other process happening in the background, figuring out who's going to pay for all of it.
And that's where payers come in. A payer is just an organization. Could be a private insurance company, could be a government program like Medicare that helps cover the costs. So the hospital sends a claim, which is basically just a super detailed bill. The payer's computer system then chews on that claim, checks it against all the rules, and decides how much to pay. It's all about this secure digital handshake between the hospital and the insurance company.
And this is why all that data we were talking about is so crucial on the money side too. The hospital sends this electronic claim that lists every single thing that was done for Alex. If even one little piece of that data is wrong or missing, the claim gets kicked back and the hospital doesn't get paid. The data doesn't just have to be good, it has to be perfect.
Okay, so we've got this incredible, deeply connected system. But what happens when one of those connections breaks? The impact isn't just a technical glitch, it's very human.
Let's circle back to that lab test for Alex. Remember that digital bridge that shoots the results from the lab's computer over to the EHR? What happens if that bridge just disappears? And this really shows you the night and day difference. When the system's working, Alex's results pop up instantly. The doctor makes a quick decision. Awesome. But look at the other side. When that system is broken, the doctor gets nothing. They're flying blind. For Alex, that can mean a delay in treatment, which puts them at serious risk. It's incredible how one little IT hiccup can have such massive real-world consequences.
So let's zoom back out for a second. Alex's story really drives home why every single one of these connections in the ecosystem is just so critical.
I mean, this quote nails it. The system really is like a living network. It's not just a bunch of separate pieces. Each part truly depends on all the others. And if that constant, reliable flow of data stops, the whole thing just grinds to a halt.
So at the end of the day, a single broken link is never just a computer error. It can compromise patient care, it can threaten someone's safety, and it can throw the whole financial side into chaos. And this is why the IT pros in healthcare are so important. They're basically the guardians of all these connections, working 24/7 to keep them strong, secure, and always running.
It really makes you think, right? In a system this connected, where a nurse, a lab tech, an IT analyst, and a billing specialist all depend on each other, every single person's job is essential. The strength of the whole ecosystem really comes down to the people who are there, day in and day out, making sure those links never break.